probably never heard of, and none of your friends probably have, because most agents don't sell Plan N. If you buy a Medicare supplement plan, you typically buy a Plan G, and if your parents or your relatives already have been on Medicare for a while, they probably have a Plan F. F's no longer for sale after January 1st, 2020. So most people are buying a G right now, and G is what we call like the Cadillac plan. It will cost the most. What will it cost you? It depends on your age that you're entering Medicare, the state you live in, and all the way down to the zip code in that state. But you want a ballpark, so let me just give you a general ballpark. If you were a woman turning 65 in 2022, and you're not in New York or Florida, you could get a Plan G at 65 as a non-smoker for $130 or less. That rate will work for almost every state. Some states it might be, $100, but it shouldn't be much more than $130 in the whole rest of the country. Now, if you are in New York, it'd be more like $350 a month. If you're in Florida, it's not going to be that expensive, but rather than being $130, maybe it's $180 a month. And you're like, well, that's not too bad. I'll take the Plan G, which is the richest plan on the market. The problem is with G is that it will go up a lot every year for the rest of your life, whether you use it or not. So if you're extremely healthy, a lot of people say, I don't really like paying this much money when I never use it. I go to the doctor twice a year. Plan N is a nice middle ground between a Medicare Advantage plans and a Plan G. Plan N will cost you less than a G, depending on your state, again, and your zip code. It'll be $20 to $30 a month cheaper per month. Now, that's not a big deal. That's not worth it on its own. I'm gonna film you. Dave's over there dancing. Because with a Plan N, when you see a doctor, you do have to pay a $20 copay. So if you're saving $20 a month and you go to the doctor once a month, which most people don't go to the doctor once a month, but if you did, you would say, well, I'm better off at a G. The secret reason why a Plan N is my favorite plan is because N will go up a lot slower than a Plan G, because not everybody's buying a Plan N, first of all, so healthier people are buying it, fewer people are buying it, and it's not guaranteed to people in all stages of life the way G is guaranteed to a lot of sick people, which will drive up over time the rates of a Plan G over a Plan N. So if you look at the historical rates, and if I'm boring you to death, I know. If you look at historical rate increases, N in the last 10 years has gone up maybe 0 to 3% a year. It very much depends on your state and the company you bought it from. Where a Plan G has gone up 5 to 10% per year. So if you start off with the N and the G and you're like, yeah, they're about this, not that big a difference. Talk to me 5 years from now. You'll be much happier with an N than you were with your G. Now, a Plan N is not the same as G. They both have that deductible, the one-time annual deductible, and it's only $233 this year, so it's not a big deal. But with an N, like I said, it's a middle ground between a Plan G, where once you meet your deductible, you don't pay for anything the rest of the year, and a Medicare Advantage plan, where every time you go to the doctor, inpatient, outpatient, everything you do, you pay a copay. Medicare Advantage, which is on this side of the screen, has a network. You can only see these doctors in these hospitals. Plan G, you can go to any doctor, any hospital. N is, again, it's nice in the middle. You can go to any doctor or any hospital in the country. So there's no network, there's no limitation. But if they don't accept what Medicare pays, you could pay up to 15% more. I've got lots of clients on a Plan N. I've never had anybody pay more than $300 out of pocket for an additional cost. It doesn't mean you couldn't. And I'll go into that more on Plan N. I have a lot of other videos, longer videos on YouTube. If you check out the Medicare family, there's a long library that can go into just this topic in more detail. But as far as my life goes, N starts off cheaper, goes up slower, and allows you to go to any doctor or any hospital. So you don't have that confinement of saying, I can only see these doctors. Now, you do have to pay $20 when you go to a doctor, but you can go to any doctor. You would pay $50 if you go to the emergency room. Those are your only two co-pays you have to deal with. So unlike Med Advantage over here, where you have to pay a certain copay for inpatient, for outpatient, if you use an ambulance, if you need oxygen, if you boom, 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 you won't have all that. It does take a little bit more work because you want to make sure your doctor accepts what Medicare pays. By law, they have to post that in the waiting room. And it's over 86% of the doctors in the whole country accept just whatever Medicare pays. That does stand to change, but for years it's been stable. There's about 11 states that don't allow doctors to charge you more. So if you live in Ohio, Minnesota, there's like 11 states, then you're in luck. I would especially recommend you buy an N if you are in those states that don't allow Medicare access, because you're never going to get that surprise bill. Oh, Susan asked me a question and then she retracted it. Darn it, I was too slow on the uptake. So for example, if you lived in Ohio, I would very much recommend an N over a Plan G. Now you will get agents that say, oh, I only sell G. A lot of that is because the agents aren't fully trained on an N, how it works, the historical rate increases. They don't know that because they don't specialize in this. I train insurance agents for a living, so I know what I'm speaking of when I say most agents don't sell it, because I see the sales that come through. We work with thousands of agents in all 50 states. And most of them they just never sell an N. They don't consider an N. If you work with somebody that really specializes in it, chances are they're going to be able to be well-versed to talk to you about all the different plans. Okay, Susan's got a question. My ex will be 62 this August. Okay, Susan, keep coming. Keep coming. So we're talking about Social Security because you can't get Medicare early. You can get Social Security as early as 62. So you got to have health insurance locked up, because Medicare you won't start until you're 65. So your spouse can either stay on your health insurance until you retire, which can be whenever, or he could go to Obamacare, which the Medicare family, we do sell Obamacare, the Affordable Care Act health insurance. Depending on your income, your joint income, it could cost you $500, $600 a month to put him on insurance from 62 to Medicare. If your income's low enough, you could get a really rich subsidy. The Biden administration has put some very rich subsidies out there for low-income people. Okay, Gen 25 American took early retirement at 62. I'll be 65 in November. Okay, we want you to call us 3 months before November 1st so that we can walk you through what's going to happen. You're automatically going to be signed up for Medicare Part B since you've been on Social Security for these 3 years. So you don't have to do anything as far as the government is concerned. But you will need to sign up for your drug plan, which what we want to do is we want to talk to you about your state and your zip code, because that's going to determine your price. We need to know the drugs and dosages that you're taking. Brand or generic, has there been any movement there? Does your doctor say you might need to get a hip surgery in the next year? You might need a hysterectomy. Your knee's about gone. You know, what's going on with your genes? How about your family? Did everybody in your family end up with heart issues in their 70s and die rather young? Or did everybody live into their 90s? They lived independently, and you hear those people, they smoked, but they still drove and lived to be 95. So what's going on with your genes? All that information is going to help us give you a better recommendation. And there is no best plan. So call us at the Medicare family. It's 1-800-970-1964. We work in all 50 states. So wherever you are, we can help you. You don't pay extra to work with a Medicare specialist because we're already priced into the insurance plans. So if you just call Mutual of Omaha Direct, you don't save money. Jojo, I'm on a special. I don't know when the questions go away. How do I get them back? Jojo. All messages are visible. There we go. I'm 65. I've been collecting since 62. We were married 14 years. Desperately need his Social Security. How soon before his birthday do I need to file? I don't know how to make this question come back again. I'm 65. Before his birthday. So he has to be at least 62 for you to draw Social Security off your spouse or ex-spouse. If If it's your ex-spouse, you were married at least 10 years, so you're good. I would file for any Social Security benefit you want. So survivor benefits, spousal benefits, your own retirement. File 3 months before you want to start receiving that money, before you're gonna be qualified to get it. When you call Social Security, prepare to be on hold 30 minutes to an hour. Call first thing in the morning. Do not call the national 800 number. Call a local branch. And if they don't answer, then you'll get routed to the national number and you'll be on hold for an hour. So prepare for that. Don't be frustrated. It happens to me every week and I hang up because I don't have time to stay on hold. But you want to apply for any benefit 3 months before you need it. I'm on a special Medi-Cal program for breast cancer. Will Medicare recognize when I turn 65 in 8 months? When you are on if you're on Obamacare, you can't stay on Obamacare once you're eligible for Medicare. So I don't know what program you're on and how that's going to interact, but I would definitely call the program you're on and ask them how they integrate or transition to Medicare. Because unfortunately, unless you're on Medicaid, you're low income, in which case you'd stay on Medicaid and you would just add Medicaid, Medicare, and a Medicare Advantage plan. We would put that all together for you. But you're gonna have to call them and find out. Thank you, Susan B. I appreciate that. So if you guys have some basic questions, I have a lot of information on our website at themedicarefamily.com. You can see a picture of me, my parents, hence the Medicare family, my son, and then there's a lot of information that's on the site. We also put out long videos. I'm in a parking lot. We also put out long videos once a week on these topics on YouTube. Does full retirement age start the first of the month or with your birthday? My birthday is 3/14/56 with full retirement age 66 in 4 months. So it'll be the first of the month. And if you're trying to get your full retirement, you can actually get it earlier. So you said your birthday was in the middle of the month. Your birthday's on the 14th. So your birthday's gonna matter when they pay you. So with Social Security, they pay you, if your birthday's between the 1st and the 10th of the month, they pay you the 2nd Wednesday of the month. So since yours on the 14th, you'll get paid the 3rd Wednesday of the month. So that's kind of important to know if your budget is tight, how to hook that up with your Medicare supplement insurance or your other bills. But your benefits will start on the 1st day of the month. So any other questions? Okay, even though I don't really know how to make this live work. You guys can always go to themedicarefamily.com and you can schedule your own appointment there. There's a little app at the top, schedule an appointment and tell us when to call you. Because I know when you're getting ready to go on Medicare, you're getting 3 to 15 calls a day. That's what I hear from all my clients. And it gets very frustrating and you don't really know who to work with. So if you want to work with us at the Medicare Family, we can help you in any state. We're not going to call you, so we're not part of the problem. If you want our help, you have to call us. So it's 1-800-970-1964. That's Eastern. And it doesn't charge you. We don't charge for a consultation anyway. Oh God. So Penny has windfall to deal with. So windfall means she's going to get a government pension from some state or local or federal government. And she also worked and paid FICA. And she wants to get Social Security too. And the government says, no, that's just too much. For you to get your pension and Social Security is too much money. It's a windfall. So the government will reduce your Social Security. This year, it's up to $512 a month. There's a whole schedule based on how long you worked, how much they'll reduce it, but the maximum they'll reduce it a month is $512. The average person this year in Social Security will get $1,640. So that's something, if you guys are nearing retirement, to go check out and see what can you expect to get. And you have that at your fingertips. Go to socialsecurity.gov, ssa.gov, set up a free account. You can do it right now. And it'll give you how much, if you died today, how much would your spouse get? If you have minor children, if you became disabled today, what would your disability payment be? And it'll give you an estimate of what you will get at your full retirement age. So it's really handy information to help you make a plan. Okay, does your spouse have to be collecting for you to be able to collect on his Social Security? Tammy, absolutely yes. The rule is different for divorced spouses and active married spouses. If you're separated, all you people out there that are separated, there is no such thing as separated as far as Social Security and Medicare. You're either married or divorced. So if you're separated, you are married. And if I want to draw on my husband, I have to be at least 62. He has to be at least 62. Half of his has to be more than all of mine. So I'm not going to get some of mine and some of his. I'm only going to get one benefit, whichever's higher. So typically his is higher because I was out of the workforce raising the kids. So I want to draw my half of his. I can't do it on my spouse until he starts to draw his Social Security benefits. So I want to draw at 62. I want to get my money as soon as possible. He wants to keep working and wait till his full retirement age, which is 67. So I cannot draw off him until he draws. What I would do, I would draw my own benefit, even though it's lower. And then when he does draw his Social Security, then I can switch up to my spousal benefit and give myself a raise. If he would pass away before me, I could switch up again to his full benefit, and that would be called my survivor benefit. Again, I have a lot of this stuff on our website at themedicarefamily.com. And I put out a lot of videos. I have a big video library on YouTube. If you have topics about the VA, TRICARE, federal employee health benefits, all these crazy topics for Medicare and Social Security, I got you covered. I got a topic that's out there. So thank you for joining me. Spread the news. Tell your friends I'm here. I don't know how to quit, but save, highlight, share, cancel. I guess I'm gonna keep going. You guys get another question until I figure out how to get out of here. Okay.